At this point, we all know there's just so many different impacts from the pandemic, and we wanted to take a look a little bit more at some of the mental health issues that we're noticing across the region, and what are some things that we're seeing, and what are some things that we're doing about that. So here with us today to take a look and share some insights on this topic are representatives from Cigna, Hope for the Warriors, Adventist Healthcare, and the American Psychiatric Association Foundation. I think I've got everybody there, but Monica in a minute is going to introduce everyone more formally, and so we'll make sure everyone's included. And so Monica, welcome. It's good to see you this morning.
Morning.
Monica Schmude is the market president for Cigna's healthcare in the Mid-Atlantic region. She'll introduce our panelists, and she's going to moderate our conversation this morning. If you have any questions at all, we'll have time at the end, so please use the Q&A box at the bottom. We will record this session and have it on our website later this week if you want to refer back to it. And with that, I'm going to turn it over to Monica and all of our panelists. Thank you again all for joining us this morning. Excited about this conversation.
Me too. Thank you, Jack. And good morning, everyone. I want to thank the Greater Washington Board of Trade for the opportunity to assemble this panel to discuss such an important topic, especially right now. As you may be aware, May is Mental Health Awareness Month, which is another reason that we're really glad to bring focus to this important topic. So let's begin the discussion. The reality we're living in right now, most of the leaders in this region are managing through just uncharted territory. The new challenges and opportunities that our workforce are facing are emerging rapidly. And with these changes, the mental health of our workforce, their families, the frontline workers, and our communities, really as a whole, have really quickly shifted mental health into the spotlight. The challenges that we were facing before this global pandemic around the impacts of stress and depression and anxiety and the growing effects of loneliness on our overall health are all now potentially much more meaningful and, quite honestly, very real to us. And so, like many of you joining together as leaders in our region, I'm working to further understand all of this. I'm being asked by other leaders, and I'm asking questions to myself like, what are the impacts on mental health that we should be aware of now as leaders? What are the resources that are available for us to deploy to our workforce, to their children, to their families, and to the communities? What are the lessons learned from other areas like our veterans that we can learn from? What are the local mental health professionals seeing on the front line? And what would these healthcare professionals tell us in order to understand, to help others, and to help ourselves? So I'm really pleased to be moderating this discussion today with such a talented group of individuals. So let's meet them. And as Jack mentioned, I'll do the introductions. We have Robin Kelleher, who currently serves as President and CEO of Hope for the Warriors, the organization that she co-founded in 2006. Robin's entrepreneurship, leadership, and passion has led this highly successful, once grassroots organization to national heights, raising over $53 million and significantly impacting the wounded and fallen military in the communities that we serve. Welcome, Robin. We also have Dr. Marissa Leslie, and Dr. Leslie is the Chief of Psychiatry for Adventist Healthcare. She's an assistant professor of clinical psychiatry for Georgetown University School of Medicine. She specializes in treating depression and PTSD in children and adolescents with an academic interest in immigrant and refugee trauma. Dr. Leslie holds a bachelor's degree in biology from Oakwood University and a Doctor of Medicine degree from Loma Linda University. So welcome, Dr. Leslie. And Darcy Gruttadaro. And Darcy is joined the American Psychiatric Association Foundation in 2017 as the director of the Center for Workplace Mental Health. As the director, she's developing and implementing the center's strategic direction and continued growth. So welcome, Darcy. And the first portion of our discussion today, we will hear from Dr. Steve Miller. And Dr. Miller leads all of Cigna's clinical policy, quality, and performance efforts. He was appointed the Chief Clinical Officer for Cigna when the company acquired Express Scripts in December of 2018. And Dr. Miller received his medical degree from the University of Missouri, Kansas City. He earned his MBA at the Olin School of Business at Washington University. I will say, as my colleague, Dr. Miller continues to amaze me and the more than 70,000 Cigna employees worldwide with his ability to not only care for our more than 170 million customers, but he upholds our mission in keeping us all squarely focused on those customers and their health, well-being, and peace of mind, especially during this time of crisis. So Dr. Miller, we'll start with you. And if you could first tell us what the research is showing about our state of mind.
Yeah, thanks, Monica, and thanks everyone for being with us today. You know, Cigna is a global health company, and so we've actually been involved in the corona crisis since January. So we have 1,500 employees in Wuhan, and so we've actually been involved in this for now 5 months. So hopefully we can share with you our research and what we've learned over the last several months as it travels across the world. And as you know, we do a lot of research in these areas because we believe that data-driven decisions are really crucial if we're going to actually defeat this virus. And when it comes to behavioral health, this is really turning out to be a major part of this crisis, because not only is there a physical toll everyone pays, but the mental health tolls that people pay is extremely great. So let me give you some insights into some of our data. Right before, we've known for the last several years that America has an epidemic of loneliness. We know that over 50% of people were experiencing loneliness even before the shelter-in-place orders. And we just completed a study called America's State of Mind, in which we were looking at the use of antidepressants, anti-anxiety drugs, and sleep disorder drugs. And we were able to actually take a snapshot between February 16th and March 15th. So the first 30 days of the crisis, when there were only a handful of cases in the United States. So we're talking about less than 1,000 cases in the United States. Already at that point in time, we'd seen a 34% increase in prescriptions for anti-anxiety medications, a 19% increase in antidepressants, and a 15% increase for sleep disorder. So even in the early days, people were actually manifesting this, going to their physicians, getting prescriptions. And so this is really having a devastating toll. And when you look at a recent survey of 1,200 consumers, and you look at anxiety, uncertainty, and loneliness, what you see is anxiety is now present in 82% of the population. And within that group, it's even worse amongst Generation Z, which is 23 years and lower. Their anxiety level is 96%, so it's off the charts. When you look at uncertainty, well, uncertainty was 77%. When you look at millennials, those between the ages of 24 and 39, it was 91%. And so when you have those people that have recently entered the workforce, they really are uncertain about their future. And then when you look at loneliness, we said that it was previously 50%. We're now seeing it at 75%. And if you're single, it's up to 80%. So these are really crisis numbers that we're seeing for loneliness, depression, anxiety, sleep disorders, the whole spectrum of things. And when we look at employees specifically, alcohol.org actually did a study of 13,000 people. And what they asked was, are you now drinking while you're at work in your home environment? And it turns out that 42% of respondents are now drinking during work. And so when we when we look at our own data for hospitalizations for alcohol abuse, pain disorder use, the opioid medications, we've actually seen, even in these early days, the hospitalizations for these going up dramatically. And so we are all suffering from this together, but there's specific groups that suffer even more. And so we really have to have solutions that are tailored for our young. We really have to have tailored solutions for our elderly populations. We have to have tailored solutions for our healthcare workers, because they're truly on the front line experiencing something that's very rarely experienced in anything but in essentially war. And then finally, our minority populations are paying a price in both sides of this. Not only do they have a disproportionate impact of the coronavirus on their outcomes, so they have higher morbidity and mortality, but it's also that group that's actually paying more of a price from the economic consequences of this. And so when you look at these special populations, we have a big job ahead of us. And for every employer listening to this, they have got to really be attuned to what their employees are experiencing and what they can do. Now, I'm actually an optimist. And so despite that start, I will tell you that I am totally confident that we're going to innovate our ways out of this. But in the interim, there is a lot we have got to do for our employees. And there are things that we have all done to help them. So we have set up not only behavioral health resources like helplines and EPA, but we actually have telehealth that includes not only keeping you out of the office for physical ailments, but you can actually now use telehealth to access healthcare providers who are doing behavioral health, doing alcohol abuse, and doing other substance abuse. And so taking advantage of these, sharing this information with your employees is really crucial. We've even done outreach to seniors. So we had literally hundreds and hundreds of our employees volunteer to write notes to seniors to be distributed amongst nursing homes because they're feeling so isolated and lonely. And these little gestures make a huge difference. And then finally, one of the things I'm really proud of, we set up something called the Brave of Heart Fund with New York Life. This is a $100 million effort in which we're actually providing essentially life insurance for healthcare workers. And when we say healthcare workers, we're talking about doctors, nurses, but orderlies, janitors, anyone who works in a licensed healthcare setting who loses their life. We're providing up to $60,000 of funds for their families. And so, and on top of it, we actually set up a special helpline for all behavioral health of healthcare workers, regardless if they're with our company or any other company. And so we all, and you'll hear this from the other members of the panel, we all have gone the extra mile to try to look after the behavioral health issues for people, but this is going to be a crisis that's going to stick with us for a long time. So I want to just give you a little bit of historical knowledge. If you go back, the last time we had a pandemic of this size was the Spanish flu in 1918. And there's not a lot written about it, but when you look at the behavioral health issues that followed the Spanish flu, remember the Spanish flu was enormously big, killed many people, and it lasted from the spring of 1918 through the spring of 1920. So it was almost a 2-year fight against this. Now, it was also in the background of World War I. But institutionalization, which was the primary treatment for behavioral health back then, went up 7-fold after the pandemic. And for a decade later, people were having disproportionate numbers of neurologic and psychiatric illnesses. And so just like in battle where you have PTSD, and you'll hear more about this from other panelists, this is going to have an extremely long tail to it. The people that are going through this are not only having the immediate psychiatric problems that are associated with a major trauma like this, but they are going to have a long tail to this. So I'm going to end here, get to the other panelists because I think they can add a lot to this. But thank you again for having us, and I'm interested in the discussion.
Dr. Miller, thanks so much. That your input really helped to set the stage by level setting us with information that we can build on, as you said, through the panel. So let's turn to the panel. Darcy, I'm going to come to you first at the American Psychiatric Association Foundation. So one of the things that Dr. Miller said is essentially we have a lot of work to do as employers thinking about helping our employees. He mentioned prescriptions for anxiety, depression, sleeplessness. So have you seen an increase in outreach for tools and resources during this time? I'm anticipating that you have, and if so, how are you working to address that?
Yes, great question. What an amazing overview from Dr. Miller, really. And thank you, Monica. This is a great forum to have this important discussion. The Washington Post put out a piece this week that really outlines the crisis that our nation faces in terms of mental health. And I think Dr. Miller provided data and information that really, brings it home. So we were working a lot on an escalating interest in workplace mental health before this pandemic hit. There are good studies showing that depression, anxiety, substance use have a major cost implication for employers. Now we see that we have a major concern with our nation facing this mental health crisis, this kind of second wave. So we have put out I have been doing presentations, many presentations, lots of interest on the part of employers, growing demand, growing interest in what are very practical steps that employers can take. I will say we put out a guide for employers on working remotely in mental health, addressing some of the issues Dr. Miller mentioned, things like isolation, loneliness, preventative measures people should be taking given the disruption and uncertainty and high levels of stress that so many are experiencing. I have to say we keep very close attention to our data, and we've had 92,000 views. That is a giant number of people interested in this topic for us, and many of the people that come to our site are employers. We are currently developing a second guide, and we're focusing really on three key areas. We're using the acronym LEAD. First is leadership, because we know how important it is that leadership set the culture at organizations. So we really want to encourage leaders of organizations to talk about mental health, make it visible. May of Mental Health is a perfect time to do that. E is effective communication. It has to be a steady stream of information that's going out to employees as they're feeling quite uncertain and quite stressed at the moment. So we want to make sure there's effective communication. Third is adapting to change, because we know change is coming, change is here, but change will continue. I think Dr. Miller said it so well with the Spanish flu. This is not going to end at the end of 2020. We're going to see this well into 2021 and beyond. And then the D is double down on access to services and supports. The mental health system is very hard to navigate in the best of circumstances. We have capacity issues, real concerns there. So we all need to really focus on what does access look like? And I think Cigna is doing a tremendous job at making information about behavioral health accessible through telemental health, telebehavioral health, but we need to make sure people understand how to tap into their EAP. So we need to make sure health plans are supporting primary care providers who will most certainly be on the front line, because we have such a shortage in workforce of mental health professionals. So we're using May as Mental Health Month as a time to really provide employers with the information they need to get to their employees around mental health. The last thing I'll say is there's a real concern around parents as caregivers. We know children, youth, teens, they are going to be experiencing tremendous stress and strain. So parents are going to have to support their children through this process. So we have to be aware that caregivers need extra support in the workplace. So appreciate this opportunity. We're really churning out a lot of resources, and we're really happy to see this focus, but are worried, as Dr. Miller suggested, about the state of mental health in our nation.
Thanks, Darcy. You've called out a couple of really important groups of people that we definitely want to make sure that we cover today, and I appreciate all the support and the tools that you continue to develop. It's amazing, and we will put up the links to those sites as a follow-up to this call as well, so more people can access them. Let's pivot to another group in our community. Robin, I'm going to come to you next. So we've been thinking about our region in terms of the very high number of active and former military members that we have, and I know while many of them have a familiarity, I should say, with dealing with a lot of change and uncertainty, they may also struggle with mental health issues. I'm curious to know how Hope for the Warriors is pivoting to support the needs of the veterans and the greater Washington community during this evolving time. Can you share some information on that?
Thank you, Monica. And I echo Darcy, Dr. Miller, that was a fantastic opening. It's a pleasure to be a part of this group of professionals. So Hope for the Warriors has been working with military and family members for 16 years through combat, through deployment cycles. We have learned a lot about post-traumatic stress. And so we've built a lot of resiliency tools to really support military families, because we know that combat is not going to end. We also know deployments are not going to end. Their military service is always going to be stressful. The resiliency tools that we've built were really based on the understanding of trauma and the effects of trauma and the timelines and what the symptoms are and responses to trauma. We've got a fantastic a group of professionals, social workers, mental health professionals, and the like on our team that have been working with these families for years. And again, we've learned a lot. And I think that the military experience can be of great value to everyone at this point because post-traumatic stress is not a military process. It is, it's a normal process that people must go through to process trauma. It needs to be acknowledged and it needs to be allowed. And those are some of the things that you need to talk about in the workplace is, and we'll talk a little bit later, I think, about the symptoms of or things that you may see in your staff, but it needs to be allowed and discussed and understood that change in behavior may not occur right now. It may be 6 to 18 months from now where you're going to see those changes in behavior. And that's something that we have to continue talking about as leaders in different communities. What Hope for the Warriors has done now, because we have been a virtual and remote comprehensive case management organization for years, the pivot here was really more about how do we take what we've learned and translate it to support the civilian community. We have seen, obviously, a rise in intakes over the last couple months, most of them related to stress, anxiety, all those exact symptoms of post-traumatic stress. But what we learned from that too is that if you carry that into the civilian world, a lot of what we learned will translate completely. And so we've built resiliency packages that we call Resilient-American, that can be a support system within any organization to not just the veteran staff, but to the civilian staff as well. I think the most important part is that we do include the family in all of the things that we offer. Children, military kids, we just, April was month of the military child. A really important part of this because we know that no one is doing this alone. While there's isolation and loneliness, the process includes the family members as well. So everything that we do includes the entire family. So I offer that because it's potentially an untraditional resource. Cigna's got fantastic resources and the others on the group would offer up very important resources as well. And I think if you looked at the idea of innovation, it's also looking at some of the untraditional resources, which may be the fact that we do have a mental health professional team that typically is working in the, in the veteran and military population, but are now looking at how can we support the civilian population as well. So I very much appreciate being a part of this, and I look forward to participating with leadership to come up with solutions that are new and innovative and are really going to drive us into the future because as Dr. Miller noted, this is not going to end once the states reopen.
Yeah. Gosh, those are really important points. And you mentioned that this is something that doesn't appear immediately, and so we need to be prepared for kind of the long-term view. But the way that you're pivoting your learning and the resources is just amazing. We thank you for that, Robin. So, Dr. Leslie, I'm going to come to you next. Thinking about the groups of providers and certainly the frontline providers, really curious from your viewpoint, how are our frontline providers doing in the region and first responders?
Well, thank you, and I echo what everyone has said. I think this is a really important panel. Thank you for inviting Adventist Healthcare. Adventist Healthcare has 3 acute care hospitals and a 4th that we're managing in Washington, D.C. So we have many frontline providers, nurses, respiratory therapists, physicians, environmental services, dietary. It's just really, really broad. And so what we're seeing are that people are brave, hanging in there, coming to work, but they're working many long hours, and they're feeling a sense of responsibility for some of the clinical outcomes that are occurring, for some of the morbidity and for some of the mortality. There's a lot of solidarity. So as Dr. Miller said, it's not all negative. There is some optimism. We're very supportive of one another, but people are physically tired, mentally tired, and there's moral injury. Trying to make sense of all that's happening to the patients we care for, to some of our colleagues, while also concerned about our own health. It's just really taxing on a system that had already been hanging by a thread when it comes to workforce morale and resilience and the ability to decompress. So I know at Adventist Healthcare, we are working aggressively to find ways to support our workforce side by side and virtually. Our employee assistance program provides virtual support to the workforce. Our chaplains are there on the front lines with our clinicians, providing emotional and spiritual support. And as a company, we're looking at how we can have a coordinated plan to address not only this crisis, but address workforce morale. I think that this crisis as with crisis, right? It has two sides. There's the crisis and the challenge, but the other side is opportunity. And we have really done some amazing things in a short period of time to leverage resources like telehealth and to leverage remote meeting, remote learning, and collaborating with our what we would have called competitors, but really with our community of healthcare. So we continue to work, but these are some of the things we're seeing on the front lines.
Thanks for sharing that. I want to acknowledge how much we thank and recognize the healthcare workers really on the front line. And you, Dr. Leslie, thank you for everything that you're doing. I appreciate you joining us today and sharing that. I wanted to focus next on access to those providers, making sure that we're making those connections between the patients and the providers. Dr. Miller, I'll come to you next. I know at Cigna we've seen a huge surge, as we have here in the region, with telehealth or virtual care for things like routine medical visits, as well as those of somewhat urgent care, and also with behavioral health. And you mentioned that in your opening comments. Curious to know from your viewpoint, is this helping? And then what are the long-term implications we should all be thinking about around virtual care?
Yeah, so great question. So one of the good things that will come out of this crisis is actually the advent of telehealth and virtual care. We've all been pushing this for quite a while because we know that, for instance, in behavioral health, there aren't enough behavioral health experts distributed throughout the country where they're needed. And so it was always going to have to be a virtual care approach for many people for behavioral health. But many people didn't want to try it. This is actually now giving them the incentive to try it because they don't want to physically be leaving their homes. And what we've seen is dramatic increases, not just in physical problems, but behavioral problems going to virtual healthcare or telehealth. And when you look at the satisfaction surveys of patients that experience it, especially once you got through the long wait lines in the first couple of weeks, the satisfaction levels have actually been quite high. And so people are actually finding it to be valuable, accessible, and affordable. In fact, as you know, we've eliminated the copay for many of these situations because we want people to be able to access it. And so I think that this is actually going to be one of the lingering benefits of this crisis, is it's going to allow our behavioral health specialists to help more people who are in the urban areas, the rural areas, other hard to reach areas where historically we couldn't reach them. And so I'm sure my other panelists have thoughts on this, but I think that that's actually going to be one of the good consequences of it. Now, don't get me wrong. Is it the same as that face-to-face interaction? The answer is probably not quite as effective, but it sure beats having no interaction at all. And so we really think that this is going to be a lasting benefit from the crisis.
Right. Agree. Any other panelists with input on that virtual care?
I'd like to talk about virtual care. I'm providing it twice a week for my patients when I'm not doing administrative duties. You know, it's interesting. Teenagers are really talking a little more via the virtual platform, and I don't know if it's because they're initiating the visits and it's not their parents or caregivers bringing them to the visits and kind of driving it. Perhaps because they're in their bedrooms or study areas and they have some privacy to share. But I've been finding that they are a little more open in the virtual platform.
Yeah, this is Darcy. I wanted to mention too that the APA, the American Psychiatric Association, has been really quite impressed with how quickly psychiatrists really stood up Psychiatry, and they've had they actually have a really impressive COVID-19 resource page for psychiatrists, but every webinar they've had on some of the mechanics of how to do it, how to practice with telepsychiatry, they have nearly crashed the system. So there's been overwhelming response from psychiatrists, and some they actually did crash it a few times, but there's been overwhelming response. The resources have stood up very quickly, and I have to say, we on the foundation side and at the Center for Workplace Mental Health, we have a project in which we're really pushing expansion of telebehavioral health. We were doing that before this pandemic came about. Now we're so excited at the rapid expansion, but we just want to make sure we can sustain that. So because we want patients and individuals receiving care to be able to choose the modality that works best for them. Some people will want to return to face-to-face. Others will really enjoy the opportunity to work with a mental health professional online. So we really want to preserve the great progress we've seen, and we want to make sure people have choice.
Monica, this is Robin. We have been doing telemental health since 2012. And I can tell you that our access to care, we had dramatic increases in intakes once we were able to launch that capability. We have social workers and mental health professionals throughout the country and have struggled with the ability to offer it throughout the country and not just in each of those states. And so we are also, trying to be a voice in that change. And as Dr. Miller said, I think this is the impetus for here's the good that comes out of this is that we should see that change coming soon. But as far as once we were able to provide that opportunity, we saw a huge increase in people who were much more interested in doing it that way. And a lot of that is our veteran population or sometimes don't have access to care or easy access to care in the place. So being able to do remote access is critical for their mental health. But I think it's fantastic that we can do this. And as far as Dr. Leslie, I think, it's interesting to see what kids are doing. They're very comfortable in an online platform. So perhaps that is why they are more open to doing it that way. I've seen my own son do the same. And so hopefully that will be our way to really address the needs that we're going to see in that population.
It's interesting how you've tied in the history and learning, Robin, that you've had back to what Dr. Miller said about using telehealth to connect those in more remote areas. And really those learnings are true connections that have been made through this time. I have to mention, Darcy, when you were talking about the rapid expansion and the overwhelming response on the technology, when you said it crashed, we all were laughing. We were all recognizing, hey, we've been there, right? But it really indicates that it's a good thing, and we're making those pivot points that are needed to make sure that the patients are getting access to the care that they need. It's great. I'm going to close out virtual care as a topic for a moment. We can certainly come back to that. I'm just checking the time. We have time now for to address some questions that came in from the registration site. So I will move to that next. And keep our panelists on their toes to know that you can jump in at any time with answering these questions where applicable. So the first question that came in asks, what are the signs to look for that your colleague or staff member may be struggling?
So I'll jump in to say, I have some thoughts on this. On our website, we have Know the Warning Signs. So I think it's really important that organizations through leadership and through HR and through managers and supervisors really ensure that people know the warning signs for common conditions in the workplace like depression, anxiety, substance use, PTSD, and excessive levels of stress. So know what that looks like. But I think the key word here is change. So I think people should expect to see some change in people, just given what we've all been through. And I think normalizing that is really important. But when you see change in an employee that is uncharacteristic for a sustained period, more than just the first few days back, change is the key. If someone's performance drops, if they're suddenly absent with regularity, if they are alone and isolated and that's not the way they typically behave and act and are in the workplace, that is a big warning sign. So change from usual or typical behaviors is an important opportunity to start a conversation. And that's what matters. It's really noticing and objectively pointing out what you're seeing and saying, I noticed that you seem to be fill in the blank, and I want to check in and make sure you're okay. Share with me kind of what's going on. So it's engaging that's really important too. And then letting people know if the person isn't willing to talk. I mean, we want to honor privacy and confidentiality. That's very important. We don't want supervisors, managers, and leaders to be clinicians. We don't want them mentioning diagnoses. We just want them to be kind, empathetic, compassionate human beings and say, are you okay? You don't seem like yourself. We've been through a lot. Let's talk about, do you know about the EAP? Do you know that we have benefits available? Just give them general information. Check in with your primary care provider. Just show that you care. That's going to be so important in the days ahead.
Monica, I absolutely agree with Darcy. And I love that she used the word normalize. I go back to what we've learned about post-traumatic stress. It is an absolute normal process, but it does come with a stigma. So it's incumbent upon all of us to normalize that process. And I think in terms of looking at changes in behavior, I absolutely agree with Darcy too. It's that we all know that there are changes in behavior in all of us. And I think you can even as leaders acknowledge your own change in behavior with your teams so that they feel that, they're already isolated. They don't want to know that their change in behavior is an isolated incident to them. So sharing your struggles and your own challenges with your staff, I think is really critical. Let them open up and talk about it, or at least just feel normal. Some of the things that we're doing is really I know it's ad nauseum Zoom calls all day long, but I've got eyes on our staff all day long. So I'm keeping them engaged, keeping them feeling like they still have purpose and meaning to the organization. But I'm also keeping an eye on what are they wearing? What time are they showing up? How is their conversation? Are they becoming combative? Are they not responding at all? Are they not turning on their video on calls? All those things that you can do as a leader by keeping your staff engaged. And then the other part is, to me, very fundamental things like cocktail parties after hours, or doing birthday parties for your staff, or inviting their kids and their dogs to join, your call one day, so that you get an idea of what people are surrounded by and you can understand them a little bit better. And then the last thing I'd say that I think is really important is understanding and tolerance with change in behavior. And as Darcy said, right now, in my opinion, is not an HR issue. It is a communication and relationship opportunity. Writing up people now for change in behavior, or change, or making them feel even more threatened in their employment is not the way to motivate and inspire your team in a tough time.
Completely agree. I just want to add, the Schwartz Center for Compassionate Care has had some really helpful webinars lately, and they've talked about the importance of checking in on our staff frequently. If you had one-to-ones with them monthly, make that more regular. Weekly is a great frequency to check in with staff. And I'm personally finding when I am vulnerable about stresses I may be experiencing without placing a burden on my staff, and I really ask, how are things going? How's online instruction for your children, and how's your family? How's your family's health? The layers of the onion just start to peel away, and you learn so many things. You learn who's caring for a more seasoned or elderly parent, who has someone who's in the hospital. It's just important to take the time. We're not sitting physically with them sometimes. Sometimes we are, sometimes we're not. So it's just really important to allow time for those things to come out.
Monica, I'd love to just add real quickly too. One of the things that Hope has done is launched what we call a 30 by 30 fitness challenge. And it is a way to connect communities and ensure, again, there's another way of engaging people, connecting with them, but also encouraging, inspiring, motivating, poking, prodding to get them up and moving, whether it's in the house with a high intensity workout, whether it's going out for a walk or a run, but it is something that is done daily, and there's accountability to it. There's even a fundraising component so people can feel like they're making a difference in the world, but most importantly, really focusing on their physical wellness so that their mental wellness comes along with it.
Yeah. Gosh, such good points. I'm just taking notes here on the side. And as Darcy and Robin spoke, I was thinking back to how much of a focus on strong and important leadership during crisis really comes back to vulnerability. And then Dr. Leslie, you brought it out exactly. How we can lead with that sense of vulnerability and make sure that our workplace is a place where people can speak openly without stigma. Really, just so important. I'm going to close out that specific question. It really drew out some great conversation. I thank you for that. And pivot into the next question that came in at registration. The question is there any historical data from scientists immediately following the 1918 flu pandemic that indicates a significant change in mental health concerns, spousal abuse, abuse of alcohol, suicide, and as the old phrase says, a nervous breakdown? And Dr. Miller, you mentioned this a bit in your opening comments. I wonder if there's anything more here that we should explore as a group.
Yeah, so what's really interesting is that if you look at the scientific data after the 1918 pandemic, there actually is an absence of writing about behavioral health issues for almost a decade. It became almost unspoken, which was probably not a particularly healthy thing, but we'd come out of a pandemic that killed probably 50 million people across the world, and also World War I. And so society actually became very clammed up. And so what we do know is we know what hospitalization rates were for different behavioral health and psychiatric illnesses, and they really spiked and they stayed high for over a decade. And it wasn't just behavioral health issues. Remember, back then, many neurologic problems were attributed to behavioral health. So even people who developed seizures, tremors, other things were often attributed to this. And so there isn't a lot of good data, but we do know that there is a really, really long tail to this. And that the other thing that was clear is that getting people to talk about their experience is actually a good thing. So when people withdraw within themselves, and my other colleagues on the call are much more expert in this, but having them withdraw into this and never voice this turns out to not be a very healthy way to adjust. And so getting your people engaged is really crucial. And those are some of the lessons we learned from prior pandemics.
And thank you, Dr. Miller. I just wanted to piggyback on that and talk about current. I know the question was about historic, but I would be shocked if it doesn't mirror what's happening now. And what's happening now is that abuse, we're really seeing that we had many social safety nets in place that are no longer in place. School is a huge social safety net. It's a place where educators and staff have eyes on children and can see if they're being victimized or if their families need more support. And we've lost that safety net at the moment. You know, a 30-minute Zoom won't capture what's going on in the home. Also, now crisis mobile teams aren't going into homes because of the public health threat. And so it's incumbent on families and neighbors to support families in crisis, to seek help. And so they have to present to a crisis center. That being said, if there is abuse, it can still be reported. But I'm pretty sure, I know it's being underreported. And I think families that were vulnerable before are even more vulnerable now. So what I'm finding as a frontline child psychiatrist is I also talk to the parents and I check in on them and see if do they have resources. And in some instances, they don't have cell phones, or they're not able to go into a store and address the utility issue that they needed. So it's huge. And children who before had extracurricular activities to protect them from toxic family dynamics no longer have that. So as much as we can, as a global community, as a local community, look out for our neighbors and look out for the vulnerable, the children, the elderly, and spouses. It's really important to try to nip it in the bud early because our social safety nets are not currently in place.
I think, Monica, this is really where resiliency comes in, and that is how you address these things, is where can we as a nation really look at resiliency in all aspects, through your church, through your employer, through your neighbors, through your, even if it's going into the grocery store, what things can we do that from what we've learned about resiliency to really execute well as a nation, and ensure, like Dr. Leslie said, that we don't get to the level of abuse and suicide and all the end state of these issues that could be addressed right now in the moment. It's really going to take, all of us coming together with our shared experiences and figuring this out together. Like you was said before, we're collaborating better now for a greater purpose, and we need to mirror that and share that with the rest of the nation as well.
I like that phrase, collaborating for a greater purpose. It's very relevant, true, and applicable right now. Thanks, Robin. Dr. Leslie, another question that came in ahead of time, and we may have touched on most of this, but I want to make sure that we answered this question. We know companies are going to need to prioritize mental health in the workplace more than ever before, especially as employees return to work, because right now employees are at home with their child or their children who may be in psychological crisis. Not addressing this impacts the workforce and the productivity of that workforce. The question is, how are companies going to address overall children's mental health? And so you spent a great focused amount of time talking about and really calling out the absence of that social safety net from a school perspective. Anything else that you would share with us that would come to mind that companies can do around this?
Absolutely. I think the first step is to acknowledge your employee as a part of the system, as a part of the family system, as a part of a community system. And any decisions we make as employers really need to focus on those systems. So in healthcare, we're essential workers, we have work-sponsored childcare. I think it's important for employers to think about what the new normal may look like. Will all of our children go back to school at the same time? Or will there need to be an allowance for flexible work schedules? The other thing we need to focus on are the benefits we provide for our employees and their families. So it's really important for children and teens to be able to access health, and hopefully It will be a lot easier to access with the telehealth and virtual platforms. But I think it's just important to start with the understanding that your employee is a part of a larger system. And when you support that larger system, you do get a more productive, more engaged employee who will stay with your company because you've addressed those greater needs.
Yeah. That's
yeah,
great.
I wanted to comment too on, I think what Dr. Leslie just pointed out around access is so critically important, because this was a major issue before the whole pandemic. Now, especially on the child side, there are not enough child mental health professionals in this country at all. So I think what employers should do from a practical perspective too is to communicate to employees, if you're having challenges with accessing care, please let us know so our HR and benefits folks can work with our health plan and find new and innovative ways to improve access to care. So the more the employer knows about it, and I know this is tricky because people can worry, and especially I think they'll worry now more than ever because they may feel like their jobs could be vulnerable and they want to really present themselves as at the top of their game. So this is all about leadership, creating that culture that allows people to feel psychologically safe to come forward and say, my family needs extra support. We're having some challenges getting it. You really want to make sure people understand it's okay to do that and it won't put their positions in jeopardy, because the key is if they're not coming forward and asking for that, their productivity and performance and the bottom line is directly impacted. The studies are really clear on this. So this really comes down to effective communication, really showing leadership around, we want to know if you're facing challenges with accessing care, and we want to work together because we know this pandemic has impacted families very hard, and we want to be there for you. Communicating that idea that we're like a family and we're going to get through this together, I think that's really important.
That's right.
Yeah, I agree, Darcy. And I think on the flip side of that too, that the leadership should really be challenging your HR professionals and your EAP programs and asking them the hard questions. How are you also pivoting as we pivot to make sure that, one, we're not talking about changes for our care, 6 months from now. I want to know now what your thoughts are. Where do you out there, who are you talking to? How are we going to address this in the moment and for the future? So I think you've got two sides. You've got that great communication with your team, but really pushing the HR professionals to rethink their models as well.
Yeah. Good call out. Okay, I'm keeping an eye on the time. And Naja, I'm going to come back to you or ask if there were any questions that came in through the chat lines that our panel can help to answer.
Thank you, Monica. We did have a few questions come in through the chat box. I'll just read off. A lot of them are contingent on the questions asked earlier. Can you share insights on any growth in suicide rates and risks?
Yeah, unfortunately, we've actually started to see some climb in suicide rates, but it's too early to say if this is going to be a trend or not. But we know historically that after natural disasters, this is a normal consequence. It's not, and I don't say it's normal, it's just a consequence of what we see. And so when you look at major disasters that displace people, they get a sense of hopelessness. And so suicide usually accompanies that, and it will not surprise us if we see the same here.
I just want to suggest too that one practical step employers can take is to communicate out the National Suicide Prevention Hotline and the Crisis Text Line. And also SAMHSA has a distress line. And by the way, their calls to their SAMHSA, Substance Abuse Mental Health Services Administration, their calls are up almost 1,000% from this same time last year. So we know those distress calls are coming in. But I would say just if you're sending out regular communications to your staff, just mention we know people are under stress. There are resources available. There is the National Suicide Prevention Hotline. There is the Crisis Text Line. There is the SAMHSA Distress Line. There are also advocacy organizations in your community. There's the National Alliance on Mental Illness. There's Mental Health America. They have online support groups that they're operating in communities across the country. So you can really have that peer-to-peer exchange, both for families and individuals living with these conditions, living with mental health conditions. So I did want to mention that as well.
I just wanted to add, piggyback to Robin and Darcy's points about normalizing it. I think it's important to actually call it out and include the suicide prevention hotline in our employee communications to let people know, yes, sometimes we think about suicide, but there's hope. There was an excellent article this week talking about the anticipated projected increased suicide rates nationally. And it ended with hope in that we don't have to accept that. We can screen, we have interventions, we've been studying suicide for a while, we continue to study it. And when you intervene early, there is a lot more hope. So it is about screening, screening, screening.
So from Hope for the Warriors, obviously, veteran suicide has been a topic of conversation for years. And we were actually starting to see some decreases in that. What I think everything that we've all talked about here today is really about suicide prevention. You know, engagement, communication, leadership, all those things actually are those pieces that lend to people not actually getting to that point. Of course, the suicide hotlines, all of those resources are so important, and they are overloaded right now. And that's can be a concern and something that leaders need to understand too, that if you call a suicide hotline and you get put on hold, that's going to be a very distressing situation. And so it's important to not to depend on that as the only source of suicide prevention. It is all these other little pieces that we've been talking about today that really are the suicide prevention package.
That's right, Robin. Naja, it looks, I'm keeping track of time. Let's take one more if we have a chat question come in.
Perfect. We do have one more question. Many, if not most, employers are needing to go through staff reductions due to the environment. How do you best reflect empathy with this worldwide business negative impact?
I'm going to jump in on that one right away, and only to share an experience from us. And this was about having to consider furloughs. And certainly, how do you do that best? And there are tools out there. People have written checklists on and language that you can use in that scenario. But for us, as for a furlough situation, we did a real deep dive into what unemployment looked like for each of our staff members. And which of those staff members, as I've got staff throughout the country, would actually not be financially negatively impacted by a furlough situation. And so we got real strategic about not making sure that if we were going to have to furlough, it would be done at a particular time so that there was time to have a conversation with those staff members so that they could prepare themselves. We looked at when would the last paycheck come in so that it would at least give them time while waiting for unemployment to arrive. And we also looked at the states whose payroll or the unemployment payments either matched or actually exceeded the salaries that our staff is receiving now, so that we felt comfortable that we weren't putting them in a financial distressful situation. And that's for furlough, but we haven't had to consider layoffs yet. But I think, again, communication is good, and recognizing that there are ways to do it strategically. And that makes all of your staff feel like you care.
Hey, Monica, sorry, you were on mute.
There we go. Hey, Jack, we're right at time, so I'm going to turn it back over to you.
Well, that's great. Thank you, everyone here. I'm trying to turn on my camera, but I can't get it on. So anyway, as we continue to learn more about our virtual environments, we'll get better at using the tools. That was really an interesting and important conversation. There's going to be a lot more to talk about in this area. you know, so many things have changed. I think it's really hard to even evaluate where we are at the moment. You know, and as you were discussing too, some of the effects we won't really know for 6, 12, and 18 months and longer, and trying to think about that. I know just personally, clearly it's very stressful. You're worried about your family, you're worried about your friends, your coworkers, your job. We're all working more. I don't know if you find this yourself, but you know, I seem to be putting in 4, 5, 6 hours more a day than normal, which is completely unsustainable because it's just right there for you all the time, and there's no natural breaks. And so, I mean, one thing that I'm trying to commit to do, and I know my team wants me to do, is to take more breaks, deliberate breaks throughout the day. And so I think there's just even little things that we should all be aware of, talking about, and making sure that we're doing so that we don't continue to be overstressed and overtaxed in this. But there's just so many different elements to this. And there'll be a lot more to talk about. So really, I want to thank you all so very much, Robin and Marissa, Darcy, Steve, and Monica. That was great. I appreciate you very much taking the time. We'll be having a lot more conversations on different topics, so stay tuned. And everyone that joined us today, thank you, and stay well and stay safe. Great. Thank you all.
Thank you.
Thank you. Thanks for having us.
Okay. Bye-bye.
Bye.